Chini Kumari, studying from Astana Medical University, Kazakhstan, Group 172, first year. So today I'm going to talk about the types and forms of the drugs. As we know that drugs can be classified in many ways, like how they are used in our body, like what is the form of the drug that is given to the patient. So today I'm going to tell you about the forms of the drugs.
So drugs can be classified based on form of drugs, based on the way by which they affect our body, and based on how and why they are used. So
First, coming to the classification based on the forms of the drugs, there are many forms in which the drugs can be given. Like there are tablets, capsules, chewable tablets, and there are powders, there are solutions, there are emulsions, there are many ointments, and there is paste, there are aerosols, and there are creams, suspensions, there are gases, there are many effervescent granules. These are the forms of drugs that can be given to a patient. Now, first talking about the tablets. Tablets are the most common form of drugs that are given to the patient. These are like small, round, solid structure drug form that is given to the patient. These are easy to handle, and they can be circular or rectangular in shape, and then there are like capsules. So capsules, these are very similar to tablets in the case of administration. In capsule, it has two gelatin shells in which the drug is packaged, and it is quite popular like tablets, but are comparatively expensive to make. And its advantages, like the liquid can also be stored in these capsules and given to the patient. Next are the chewable tablets. So chewable tablets are similar to tablets in appearance, but they are large in size, and they have a very unique, or we can say attractive color, and they have attractive odor and sweetness. They have a sweet taste, and these are meant to be chewed in order to release the drug from it. And for example, there are antacid tablets. Next are the powders. So these are the solid dosage forms that can be applied for the local effect. So these are used for dusting and external applications, like in the wound or any cut or any skin infection. So next are the solutions. In these solutions, the drug is dissolved in an adequate solvent, or we can say suitable solvent, and there is swelling of a fixed volume of this liquid solution. And these solutions are mostly clear liquids that can have color, taste, and also acceptable odor. Like there are nasal drops, eye drops, ear drops, like that. So next, coming to the emulsions. In the emulsions, it is a formulation where the water insoluble drugs are made into a liquid formulation by addition of there are soap emulsifiers, like that emulsifiers. So what happens, these emulsifiers form a coating in the outer surface of these of this drug, and when these are mixed with the water, they are given to the patients. So basically they form a film or cover around the drug. Next are the suspensions. In the suspensions, like these are the liquid formulations also, but the difference is that they have fine solid particles in an aqueous liquid, and these can settle down at the bottom. Therefore, you may have seen, like, there are instructions given that shake well before use. These are these suspensions that can settle down in the bottle or any container when they are mixed in this aqueous liquid. So these are given to the patients. And next are the ointments. Ointments are a solid, semi-solid dosage forms. Like they are applied on for a local effect. So next are the effervescent granules. These are also in the form of effervescent tablets. And when these are put into the water, they undergo chemical reaction to produce carbon dioxide. And this is when swallowed, the gas is released from this, so it helps in relieving gastric activity. Next are the aerosols. Aerosols are actually a powder or liquid formulations which are applied by spraying. So these formulation is released as gaseous dispersion, and they can reach deeper locations, like there is a respiratory tract. Next are the gases. The gases, like there are pure oxygen, carbon dioxide, and there is nitrogen. These are also used as a drug. And now next is the suppositories. These are actually solid dosage forms which are intended for insertion in the anus. These are like, for example, there is enema. So these are given to the patient which are suffering from constipation, etc. These are used to loosen down the bowel movement. So next are the injections. These are the solution based formulations which are given through the parenteral route, and these are preferred for an unconscious patient. Like the drugs are given immediately through the injection. Now next categorization is based on the way by which they affect our bodies. So there are three kinds of this way. There are hallucinogens, there are depressants, and then there are stimulants. What happens in the depressants? These depressants slow down the function of our CNS, or we can say a central nervous system. Basically, they slow down the messages between our body and our brain. So our concentration and coordination is slowed down. It can affect our ability to respond, like what's happening around us. And the small doses of this depressants make us feel relaxed, but this large doses can cause vomiting, nausea, and even death. So next are the hallucinogens. What happens in the hallucinogens? These affect our senses and change the way we think, or we can say the way we hear or smell or taste or feel things. Like it changes the reality, and we can see things that are not actually happening in the surroundings. Next are the stimulants. These stimulants actually speed up the message between our brain and our body, and it can cause our heart to beat faster and our blood pressure to go up, our body temperature to go up. There is a reduced appetite, and like that. Basically, it gives us energy. So, what are the examples of these three types? So, there is cannabis. It can fall into all the three categories of this. It is also a stimulant, it is also a depressor, and it is also a hallucinogen. Next category is based on how these are drugs commonly used. First are the analgesics. You may have heard about analgesics or painkillers. So these painkillers relieve the symptoms of pain, and some people take more than the recommended range of these painkillers, and they cause self-harm, and they can also be overused by people who have chronic pain. So as I was talking about painkillers, these painkillers can be available like on the counter, or these can be given by prescription from the doctor. So medicines like there is paracetamol, there is aspirin, there is ibuprofen. These are available over the counter, and some other require a prescription from the doctor, like there is codeine and paracetamol combination products, and there is fentanyl, there is morphine. The next type of this classification is inhalants. These are the substances that are breathed in through the nose, or the mouth, in by the nose by sniffing or by the mouth, and these are absorbed into the bloodstream very quickly, and these can get the people intermediate high. So there are four types of inhalants in basic. There are volatile solvents, there is aerosol sprays, there are gases, and there are nitrites. And most of these are depressants except for the nitrites. Nitrites are like there are room deodorizers, and there are leather cleaners. These are the nitrites. So the three categories except the nitrites are depressants. Next type is the opioids. So opioids are a type of painkiller that can be made from poppy plants, like heroin, or they can be produced synthetically, like there is fentanyl. So these are also called opiates or narcotics, and these are addictive, and they can give a feeling of well-being, or they can cause euphoria. So these example into the codeine, heroin, methadone, and there is oxycodone. So then there are the party drugs. Party drugs are actually a group of stimulants and hallucinogens. Party drugs are basically used to enhance the activity in the party, or any concert, or etc. So the common party drug is ecstasy, which is MDMA, but mostly there is not MDMA present in these party drugs. Like there is no proof that they are fully pure. They can also contain many other substances. So now are the performance and image enhancing drugs. You may have heard that some athletes take drugs before their performance to enhance their activity. So these are these performance enhancing drugs. So there are three types of this performance enhancing drugs. These are anabolic steroids, there are peptides, and there are hormones. So first, coming to the anabolic steroids, these are basically synthetic hormones that help grow and repair muscles. So now next are the peptides. These stimulate the release of human growth hormone, which is involved in the muscle and the bone growth. And the next are the hormones, like they can be both natural and they can be both artificial. For example, there is growth hormone, there is insulin, like growth factors. Now next are the prescription drugs. Prescription drugs are the medicines that are prescribed by a doctor, which we also call as pharmaceuticals. So these are basically not used appropriately, then they can cause harm, and these can also cause short and long term harm. So these are prescribed by the doctor only. Example, there are painkillers like there is codeine, oxycodone, and there are sedatives and sleeping pills like benzodiazepine. So next are the psychoactive drugs. Psychoactive drugs basically affect the way we think or we behave or we feel. Like they give us energy. For example, there are caffeine. These stimulate our ability to wake, and there are cannabis, and there is psilocybin, which is also known as magic mushroom. So these are the psychoactive drugs. Then the last type of these are synthetic drugs. Synthetic drugs are the range of drugs that have been developed to create similar effects, like there are banned drugs, like there is morphine or any other drug. So these copy the effects of these morphines, heroines, etc. drugs, and their structure is really different from these drugs, but these copy the effect that they cause. There are synthetic cannabis, and there is N-boamine, which is N-methoxybenzyl. So these form similar effects like to LSD. So these were the types in the forms of the drugs that can be given to the patient. So this was all about today's topic. Thank you.